Another one of the treatments we offer here at the clinic is mesotherapy. This technique was invented in 1952 by Dr. Michel Pistor. It consists of injecting various substances into the layer of fibrous tissue that lies beneath the skin, known as the mesoderm. This is done with fine, tiny needles, the size similar to that of an eyelash. To avoid any discomfort, an anesthetic cream is applied before each treatment so that the injections are practically undetectable. Small amounts of different medications are administered in specific areas depending on the medical problem we are trying to correct. For example, if you want to diminish the fat in a certain part of the body, we inject a substance directly into the area just below the skin surface. Therefore, we obligate the cells that harbor the fat to release the fat out of them. This recently released fat is carried out through the blood to the kidneys and small intestine to be released through the urine and bowel. The same can be done if you want to treat cellulitis. Cellulitis is formed when bands of fibrous tissue entrap an undetermined number of fat cells, creating lumps and indentations of fat deposits. Therefore, we can also inject that substance into these fibrous blocks so that they can release the fat from these deposited areas. Immediately after each treatment, there is a small inflammatory reaction to the treated area, along with minor burning sensation that can be easily controlled with the application of ice. Naturally, as with any procedure, there is a limit to the amount of solution we can inject. For that same reason, multiple treatments are necessary to achieve the desired effect. The number of treatments depend on the amount of fat we wish to diminish. Therefore, the more fat there is, the bigger number of treatments required. Now we can see a series of before and after photos to appreciate the changes that can be expected with this treatment modality.
The latest technique in the application of mesotherapy is a modality we call transderm. This method consists of using very short and low electrical discharges while applying the liquid to the skin. These electrical impulses will carry the liquid through the skin to the fat tissue without having to penetrate it with needles. At the same time, a faint vibration is produced by the machine to mask any kind of discomfort. The great advantage of this modality is the absence of pain during the treatment and the lack of inflammation or swelling of the treated area. The second advantage is that because there is no inflammation after each procedure, the treatments can be done more frequently and thus achieving results on a shorter period of time. This is a transderm machine. It has a plastic tube connected to a system that will push the liquid at the desired speed. When we apply the tip of the device, first turn on the vibration and then we increase the electrical impulses up to the optimal intensity. We then proceed to apply the liquid over the entire area to be treated as if we are massaging the skin. Do you have any pain, any discomfort?
No.
And this is it. How do you feel?
Very good.
No pain or
No
discomfort?
pain whatsoever.
Wonderful. Now we can schedule the next appointment in a week if you want to, or we can wait the ideal time, which in my feeling is that we need 2 weeks to schedule the next treatment.